Welcome, everybody. Glad you could join us tonight. Welcome to the February meeting of our nonprofit plant-based nutrition organization of Wisconsin, or PBNOW. I'm your host, Terry Lynch. The mission of our nonprofit group is to educate, inspire, and support each other on an evidence-backed, whole plant food-based nutritional path for health and improved quality of life. Our group is open to everyone, both plant-based and those just curious about it, and it's meant to be a non-judgmental place to get information, inspiration, and support. If you'd like more information about our group, our upcoming meeting dates, speakers, and resources, or to check out videos of our past meetings, just Google us at pbnow.org. That's pbnow.org. As we do each time, can I see a show of hands, either by raising your hand or using your thumbs up, a reaction icon on the bottom of your Zoom screen to show how many of you are currently following the plant-based lifestyle? I'm seeing a bunch of hands going up there. Oh, that's excellent. As we mentioned at the beginning of each meeting, the evidence of the benefits of plant-based nutrition in improving health and quality of life for people of all ages, as published in non-biased medical research, is quite striking. Whether it's improving health through increased energy, weight loss, preventing, slowing, stopping, or reversing problems like allergies, digestive problems, diabetes, heart disease, and early dementia, or increasing quality of life by helping us feel better quickly, strengthening our immune system, increasing our endurance, improving athletic performance, speeding recovery from exercise, reducing joint pain, clearing thinking, or reducing the physical, emotional, and financial side effects of the illnesses, drugs, and procedures that are often recommended to treat the conditions plant-based nutrition can help us avoid. The research shows that our bodies do a wonderful job of healing themselves if we stop damaging them daily with poor nutrition and start giving them the nutrition they need to heal, to function optimally, and to give us a chance to enjoy each day of our lives. It's truly remarkable. Now, let me tell you what's in store for you tonight. Tonight, we'll hear from a number of speakers. Our first speaker will be our PBNOW Medical Director, Dr. Josh Liberman, who will share some of his thoughts. Our second speaker will be local plant-based health coach, Michele, STAMM, who will give us a short talk about an interesting benefit of plant-based nutrition that she's personally observed. And our featured speakers will be a panel of 5 Milwaukee area doctors who will talk to us about their thoughts and experiences with both plant-based nutrition and the emerging field of lifestyle medicine that includes nutrition as a major pillar. Tonight's program should end about 7:30. As a reminder, we have meetings every month, usually the second Thursday of the month. Next month, Dr. Sandra Musial, Executive Director and President of Plant Docs in Rhode Island, will be speaking. In the future, we'll be hearing from Drs. Caldwell Esselstyn, Michael Greger, Andrew Freeman, among others. We'll be posting more information about our next meeting and our upcoming meetings on our website, pbnow.org. And if you register there, you'll receive an email reminder of our events as they approach. Last, a quick technical note. During the meeting, everyone but the speakers will be muted, and we ask that you stay that way to avoid background noise and allow everyone to hear the speakers. All right, here we go. Our first speaker tonight is a fellowship-trained cardiologist. He's president and CEO of Wisconsin Cardiology Associates and is past president and current trustee of the Wisconsin chapter of the American College of Cardiology. He's a member of the American College of Cardiology's National Nutrition and Lifestyle Work Group, whose membership includes nationally known physicians such as Dr. Dean Ornish, Dr. Caldwell Esselstyn, and Dr. Neil Bernhardt. He's an advocate for the use of plant-based nutrition to help improve health, general health, and quality of life, and has seen the benefits of plant-based nutrition in both his personal life and that of his patients. We are fortunate to have him here in Milwaukee and as our PBNOW Medical Director. I'm happy to welcome Dr. Joshua Liberman. Dr. Liberman?
Thanks, Terry. Thanks, everybody, for being on. So I don't want to take up too much time because we have a lot of great speakers tonight, but I just want to point out something that we've had some pretty famous speakers on the PBNOW calls over the last couple of years. We've had people that have been, multi-million sellers of books. We've had, obviously Dr. Michael Greger. We've had Neil Barnard talk to this group. We've had a lot of really famous people, and yet we have never, at least as I recall, had so many people being on this call. 65 people so far on this call. And who do we have here? Nobody famous, right? It's just local, plant-based, lifestyle-based docs. And I just think that that's really wonderful. And I just really wanted to highlight that you can't get better than that, that there's a tremendous turnout. There's a tremendous demand for plant-based docs and for docs that really try to focus on lifestyle in our communities. And when people hear that there are some, they're excited and they flock to calls like this. So I appreciate you all for being here, and I'm looking forward to meeting some of these people too myself. And I think it's just wonderful. I think it's just wonderful. So for those of you who have been on prior calls, that I try to talk about maybe a case from my files from my office, as well as something that piques my interest in the literature. Most times that involves plant-based research, but sometimes I throw you guys a curveball just because there's something that piques my interest, and I guess you guys all have to just put up with it and bear with me on those kinds of things. First, let's talk about a case I saw, and again, it really just highlights the importance of lifestyle. And this is actually not a case that really highlights a plant-based lifestyle, not necessarily, but a 42-year-old woman was referred to me a couple months ago, pretty overweight and with blood pressure that was sky high. I mean, over 200. She was having headaches. She was already having some vision changes. At the age of 42, she already has some kidney issues from having just completely uncontrolled blood pressure. She's a professional, and she has no kids. She's married, and both she and her husband work, and they work really long jobs, really long hours, stressful jobs. And when they get home, they don't have the desire or interest in cooking, right? So they're dependent, really, through conversation. It was very clear they're dependent on basically convenience food, fast food. They'll call each other basically on the ride home and say, "Hey, what are we ordering in tonight?" And they're either ordering Grubhub, or they're just picking up something on the way home, and they're doing no cooking because they just are flat out exhausted by the time they get home. And she was already on some medication for blood pressure, but it wasn't doing the job. And not too surprising. It's hard. It's like putting It's like putting your thumb in the leaking dam. And so we talked about how it was really going to be hard to control her blood pressure if her diet really consisted mostly of fast food or fast casual food or things like that. And what we came up with, so we of course talked about the benefits of a plant-based diet. That was not happening, right? So that's just too far to move for some people right away. Maybe I need to have her talk to Michele, and she can work with her a little bit. But in any case, it's too far it was too much of a chasm to jump right away from a horrible American diet. I mean, even just worse than a typical standard American diet. I mean, this is just really just all restaurant food. To a plant-based diet, right? So we compromised. And so what they're doing now is they're ordering HelloFresh. I tried to put in a plug for Amber Lee's business, Plant Joy, but again, being vegan, she just had really no interest in that. I don't make any commissions on selling HelloFresh memberships or whatever they call them, subscriptions. But I said, by definition, that's going to be healthier than 90% of what you're eating. Because you're seeing what's going into it, you're making it yourself. It's fresher at least, but it's going to have a lot less saturated fat. It's going to have a lot less sodium. Is really the killer for her. And sure enough, they bought a subscription membership, whatever you call it, and they're doing that basically 7 nights a week, and her blood pressure is now controlled in 3 months. She's still on medication. She's still not losing a ton of weight. Right, we still have a lot of things to tackle, but it really just highlights, I think, the tremendous impact that our nutrition has on our health. From going from blood pressures in the 200s, from changing to really unhealthy food to less unhealthy food, her blood pressure is controlled. She's still on medications. She's still overweight. She still has some kidney issues. It's not, it's not a complete fix. It's not a miracle. But we got her out of trouble. She's no longer at, kind of imminent risk of having really severe permanent damage to her brain and her eyes and her kidneys. And over time, we'll work on it. But I really, to me, that really just once again emphasizes, as I said, the power that nutrition has on our health. Okay, so that's the case. Now, as I said, you're gonna have to bear with me on this journey, because there was this article that came out in what was called JAMA Internal Medicine, which is the Journal of the American Medical Association. It's one of the premier kind of medical journals. And this is really focused, they have a lot of subdivisions. They have, JAMA Neurology and JAMA Cardiology and stuff. But this was just JAMA kind of Internal Medicine. And it made me think back actually to the beginning of my career. So in 1999, there was a huge hullabaloo about a study that came out. It was actually published by the Institute of Medicine, and maybe I bet some of the doctors, depending on ages, on this call right now, may be familiar with it. But it was a report called "To Err Is Human," and it was highlighting the really high prevalence of medical errors that occurred in hospitals, and how it was actually scary. It made a lot of news. It actually provoked a change in some legislation. Bill Clinton was the president at the time, and they created basically an agency to look to try to improve health outcomes and look at the quality of care. So this was a big impact. But it was called "To Err Is Human: Building a Safer Health System." And as I said, based on analysis of data, it estimated that somewhere between 44,000 to 98,000 people died each year simply as a result of preventable medical errors in hospitals. Again, this was kind of earth-shattering at the time. It was basically suggesting that 2 to 4% of all deaths in the US were caused by medical errors, right? By doctors, nurses, whatever, doing the wrong things. This is a horrible statistic, right? And so there was a lot of wringing of the hands and whatnot. There was a lot of interest in analyzing the causes and instituting plans, protocols, all these different initiatives to try to reduce that number. That's the backdrop. Let's fast forward now to last month, 25 years later. It's a nice round number. 25 years later, how have we done? Well, there was a study that came out, and this is, of course, what made me think back to the beginning of my career. This was a study published. It was a retrospective study at almost 30 academic medical centers in the U.S. Right, so this is where theoretically the best and the brightest are practicing. This is where they're doing research, cutting edge stuff. These are not podunk, rural places where they have a doctor only half the time or anything like that. So almost 30 academic medical centers, and they looked at the year 2019, and they looked at all patients transferred to the ICU. So they were just looking to, so it wasn't all patients or anything like that. They were just looking at a very, very specific population, and they said, okay, let's just take a look at all patients transferred to an ICU who died in the hospital. And they took a random selection of those patients. It was about 2,500 patients, and they looked at these records. And they found that a missed or delayed diagnosis happened in 23% of them, and 17% of those errors actually caused either temporary or permanent harm, including death. Pretty scary number. Now, again, this is not all comers. This is not all deaths in the US or anything like that, but it still highlights the problem that medical care is imperfect. The study highlighted that the two main categories of potential errors, the first one was problems related to testing, such as like choosing the correct test or ordering the test in a timely fashion, or doctors correctly interpreting the results. And the other main error, the main source of error, was errors in assessment, like recognizing complications in a timely manner, or even like in face of new data, rethinking the original diagnosis. So this is stuff that you expect from your doctor. Like, you expect that we should be able to react to tests, to rethink our original hypothesis, to do things in a timely fashion. And unfortunately, we're not remotely near where we need to be. Now, It's important to note again, to highlight that this was a selected sample of the sickest patients in the hospital, and some of these patients were going to have poor outcomes regardless of these errors. But the fact of the matter is that 17% had errors that led to, permanent harm or death. So what does this mean? Of course, one lesson is that even in the best of hospitals with the best doctors, mistakes can really happen. I think it's important to understand that, nobody is perfect. But what I take from this, certainly, and in light of my career, is that bad stuff can happen to you when you're sick enough to be hospitalized. Sometimes the condition for which you're hospitalized can kill you, or cause serious or permanent harm. Sometimes your condition can be so complicated that it's hard to diagnose exactly what's happening, and therefore it's harder to treat. It's harder to react timely. What can we do about it? Prevention. If we spend our time and focus our attention on being as healthy as we can be, which includes being active on a regular basis, which includes eating a healthy, whole food, plant-based diet, certainly in my opinion, which includes getting enough sleep, which includes having community and love in your life, and having appropriate blood pressure and cholesterol and sugars, and not smoking and not exposing yourself to toxins and whatnot. If you can do these things, we know that you dramatically reduce the chance that you would get admitted to a hospital, where we know, unfortunately, that even after 25 years of work, errors still happen. So that's my plug. That's why I'm proud to be part of this group, and that's why I'm really looking forward to hearing from some of these other special providers and professionals on this call. So thank you all again, and let's get into it.
Thanks, Dr. Liberman. That was excellent. Our second speaker tonight is a local certified plant-based health coach and former physical therapist based here in southeastern Wisconsin. She's the owner of the Wellness Empowered, where she supports people through virtual appointments, guiding them how to incorporate plant-based nutrition into their daily lives and increasing their chances of successfully reaping the benefits of plant-based nutrition. I've asked her to put up her contact information sometime during her talk. And once again, we don't get paid for anything here. We're not a nonprofit, but I want everybody to know where to contact these excellent professionals. They can help you learn how to use plant-based nutrition for your benefit. Tonight, Michele will be sharing briefly about the amazing effects that a plant-based diet can have, decreasing inflammation and pain in the body. Michele?
All right. Thank you so much, Terry, for having me here tonight. I'm super excited to talk with you and everybody else here. So hello. When I first started working as a plant-based health coach, I knew that a plant-based diet was going to be able to help my clients with all kinds of things, with lowering their blood pressure, lowering their cholesterol, balancing their hormones, even reversing their diabetes in some cases. But I honestly had no idea what a huge effect that a plant-based diet could have on somebody's inflammation in their body, including the related joint pain that so many people get in their middle and older ages. The effect that has happened like this has been such a big surprise for me. You see, as Terry said, I'm a physical therapist, which means that for over 30 years, part of my job has been helping people to quell the inflammation and pain in their bodies. Now, in my work as a PT, I've had a lot of tools at my disposal: strengthening exercises, stretching, manual therapy techniques, retraining body mechanics, massage, TENS units, soft tissue work, ultrasounds, hot packs, cold packs, all kinds of things. But I am telling you guys, nothing that I've ever done as a PT has helped patients in physical therapy has been so consistently effective in completely removing pain from their bodies and joints as I've seen a plant-based diet be for people, which has completely blown me away. Now, I've seen this quite a bit now over the past 2 years of being a plant-based health coach, but it never stops being exciting for me. So I want to share with you guys tonight a few stories that I have from some of the clients that I've coached. Now, if you heard my PBNOW presentation in December, a couple of these stories are going to sound a little bit familiar, but they're really good. So I think they bear repeating. Now, the first time I saw this pain disappearing thing happen, I was working with a woman in her mid-50s, and she had terrible knee pain when she started seeing me. She rated her pain in both of her knees as an 8 or 9 on a 10-point pain scale. Now, if you're not familiar, probably most of your doctors have had doctors or therapists ask you to rate your pain on a pain scale, but if you're not familiar with this, 0 is ideal, no pain at all, and 10 is like excruciating emergency room kind of pain. And this woman rated her pain as an 8 or a 9 on that 10-point scale. So it was pretty bad, and it was in both of her knees. She was pretty certain she was headed for a total knee replacement in both of her knees. Because of this pain, she avoided the stairs as much as she could, and when it was time to bend down into her lower kitchen cupboard, she called her kids to do that because it hurt her knees too much to do it. Then, in working with me, she decided to go fully plant-based. And a couple weeks later, she found herself surprised to be squatted down on her kitchen floor, grabbing out one of those pots from the back of her cupboard. And she said she kind of was like, oh my gosh, how did I get down here? Like she just sort of naturally did it. But then after she was down there, realized what had happened. And then she was scared, right, to stand back up. She thought it was really going to hurt, but she had to get up. So she stood up and it didn't hurt at all. And she was so excited that she stood at her countertop, kind of doing little mini squats over and over because the pain was gone. It went from an 8 or a 9 to a 0. And like I said, it happened in a few weeks. It wasn't like she lost 50 pounds or something, and it was the result of lost weight. No, it was the result of the decreased inflammation in her body. And I will say, she did not have 50 pounds to lose. She was not really overweight. So, and this is not a unique story. I have had the same knee pain disappearing in at least 5 different middle-aged women that I've worked with now, where they used to avoid the stairs and now they're fine on the stairs. So that has been super exciting. Okay, so you might be wondering how long it takes for this change to happen. Of course, everybody is different. The woman I just told you about, it took her a few weeks for that change to happen in her knee pain. But let me tell you about this next woman that I worked with. She's 62 years old, and she went fully plant-based at our first coaching session. And our second session was 6 days later. Now, I admit to you guys, even I thought I was crazy asking her if she thought she had experienced any changes in her body as a result of going plant-based because it had just been 6 days. But when I asked her the question, she said, yeah, you know what? My hands don't hurt anymore because I normally kind of am clutching my hands like this because of all the aching in there from my arthritis. She's like, that's totally gone. And you know what else? My feet don't hurt anymore either. When I get up at night to go to the bathroom and I don't have shoes or slippers on and I'm just walking in my bare feet, my feet don't hurt at all anymore either. So you guys, 6 days and her hand and foot pain from arthritis disappeared, and it's been over a year now and it's still gone. Super exciting. I recently started working with another woman who's 63. And when we met, she said she was resigned. That was the word she used, resigned to having hand and thumb pain for the rest of her life. Because, she's in her 60s now and she's getting older, and she just thought that was how it was going to be. So 3 weeks into eating a plant-based diet, her hands don't really hurt anymore. And she hadn't been able to do things like open packages or twist off jars. Now she can do that pain-free. She can tie her shoes without it hurting. And this was really cute. She, at one of our Zoom sessions, we always have Zoom sessions, she brought a ski glove to the session, one of those thick gloves, that's really thick fabric. And she showed me, she wanted me to see that she had mended the seam on this glove using needle and thread and barely a thimble because her hands don't hurt anymore. And just a month earlier, that never would have been something she could do. Oh, and she can run up and down the stairs with no knee pain now too, which is another change she experienced. In fact, when it was so cold out here in Wisconsin a few weeks ago, she decided to exercise in her apartment or condo building, and she ran up and down the stairs for 10 minutes with no knee pain, which was, again, a pretty big change for her. Okay, just one more story, because I know we have other speakers tonight that are really great that we want to get to, but I want to tell you about this 7-year-old woman that I worked with last summer. She came to me because she wanted to shift to a plant-based diet to lower her cholesterol and to lose some weight. Now, I looked back at my notes because she didn't even mention plantar fasciitis when she came to see me, which of course she didn't, because how would she know that a plant-based diet would help plantar fasciitis, right? But after just a few weeks of eating plant-based, she came to one of our sessions so excited to tell me that her plantar fasciitis was gone, completely gone. Now, as a physical therapist, I'll tell you, when somebody comes in to see me and they have a diagnosis of plantar fasciitis, I'm like, ugh, okay, we're going to try all these things, but plantar fasciitis can be very stubborn to treat. It does not just go away. Yet for this woman who went on a plant-based diet, it just went away. She had struggled with her plantar fasciitis for years with pain levels of 3 to a 4 out of 10. When she was running or walking a long distance, she had that kind of pain. And now it's gone and she can run or walk as far as she wants without her foot pain interfering at all. It was almost like magic, but it wasn't. You see, animal foods and processed foods are inflammatory, and plant foods, on the other hand, are anti-inflammatory. So it doesn't take a genius to think that if you eliminate the inflammatory foods from your diet and then calm the inflammation with the anti-inflammatory plant foods, amazing things can happen inside your body. Now, I do realize these are just anecdotal stories. I am not a formal researcher and I will never be one. That is not who I am, but I can't keep these stories to myself. They're just so exciting and it can't be a fluke if it keeps happening over and over. Now, none of these women I just told you about had any idea that a plant-based diet was going to make their pain completely disappear until they gave it a try. Heck, I didn't even know that. I told you guys, I didn't know this was going to happen back when I started my coaching business. So the question is, can a plant-based diet help your pain? Can it help reduce your pain or the pain of people you love? There's only one way to know. I don't know. There's only one way to know, and that is for you to give it a try. Otherwise, you're never going to know. So that is just one additional benefit I want you guys to know could happen if you go on a plant-based diet. So I'm just going to share my screen really quick here with you guys for a second. I want you to the QR code that's up there brings you to a landing page where you can join my mailing list. So every Wednesday morning, I send out an email, and in it, I tell stories just like these 4 stories I told you tonight. So if you like inspirational stories about eating plant-based, please use that QR code, or else I'll drop a link in the chat. But join my mailing list, please. I share stories like this. I share my favorite plant-based recipes and resources, all kinds of things that are meant to help you on your plant-based journey, whether you're just getting started or whether you've been doing this for a long time. So, and honestly, if there's anything I can do to help any of you make the shift to eating a plant-based diet, that's literally my job. It's what I love doing. So please don't hesitate to reach out. All right. Thank you guys so much for listening.
Thanks, Michele. Forgot to unmute. That was excellent. And by the way, I think Michele, that newsletter, I think just came out today, her regular newsletter, today or yesterday, maybe it was.
Yesterday.
And there were 3 stories of people who started in January who had tremendous benefits already. It's just amazing. I'm continually amazed at how quickly some of this can happen. Next, we're lucky tonight to have 5 excellent Milwaukee metro area doctors who are knowledgeable about both plant-based nutrition and lifestyle medicine, and recommended to their patients where appropriate. And of course, it's hard to imagine where it wouldn't be appropriate. But for this portion of the meeting, I'll be asking the doctors a number of questions in an interview format. And for those of you who also have a question, you might want to ask one or more of the doctors, just pop your question in the chat box or keep it in mind. And hopefully we'll spend the last 15 to 20 minutes tonight doing Q&A with the questions that you put up or calling on you, those who raise their hand when we get to that portion. Just before introducing the panel, I'd like to mention that tonight or once again mention that we're not just talking about whole food plant-based nutrition, but we're also going to talk about lifestyle medicine. And I'd like to give you a quick a definition here for lifestyle medicine. Lifestyle medicine is a rapidly growing discipline that focuses on the role of lifestyle factors in preventing, managing, and reversing chronic disease. At this point in the field's evolution, there is strong evidence that the 6 pillars of lifestyle medicine, a whole food, plant-based, plant-predominant eating pattern, physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social connections are central in the creation and maintenance of health. Previous publications, many of them randomized controlled studies and meta-analyses, have solidified the evidence base for the use of these 6 pillars within the field of lifestyle medicine. And I should mention, doctors can correct me if I'm wrong here, but lifestyle medicine is concerned both with the health and well-being of the individual. There are people who can be healthy, but still have ways to go to feel a sense of well-being. Lifestyle medicine attempts to cover both these important areas. With that being said, let me introduce our panelists here.
Hello.
Hi, Rania. Rania is a former sports medicine specialist who has become a lifestyle medicine physician with a passion for sharing research-supported healthy living practices, and she runs Empowering Lifestyle Health. Dr. Aimee Welsh,
Hi there.
is a non-invasive cardiologist specializing in preventive cardiology and cardiac imaging for Froedtert and Mequon in West Bend. She's focused on preventive cardiovascular medicine, where she takes a holistic approach to patient care, integrating traditional medical management of cardiovascular disease and risk factors with healthy lifestyle medicine interventions, including plant-based nutrition. Dr. Ken Jacobsohn is a urologic oncologist, fellowship trained in minimally invasive urologic oncology and board certified in urology. He practices at Froedtert in the medical complex in Wauwatosa and is also boarded in lifestyle medicine. Dr. Michael Lenz is board certified in internal medicine, pediatrics, lipidology, and lifestyle medicine, and practices with Froedtert in the Tosa Health Center on North Mayfair Road. And Dr. Larry Miller is a psychologist working on the well-being portion of lifestyle medicine. He helps people cope with psychological and/or social distress using a holistic healthcare approach to improve his patients' health, quality of life, and well-being. And he, like Dr. Lenz, also practices at Froedtert's Tosa Health Center on North Mayfair Road. Thank you all for being here tonight. I'm going to start with the first question, and with this one, I'd just like to see a show of hands if I could. When you were in medical school, how many of you received nutritional education in medical school? Oh, Dr. Lenz, all right. That's 1 out of 5. So that I think that's probably more than if you took all the physicians in the United States to get together. It's probably a much smaller percentage. How many of you received nutritional education in your internship, residency, or fellowship training? And now we're up to 2, so almost half. But that's that just goes to show that we've got a ways to go in the medical education system that we have here in the United States. After hearing what both Dr. Liberman and Michele mentioned is the quick benefits that we can get from plant-based nutrition, which is just one pillar in lifestyle medicine, you would think that we'd start seeing this in the medical education system. So, but the next question is, and I'll ask this individually, and I'll start with Dr. Welsh. How did you find out about plant-based nutrition and lifestyle medicine, or kind of what was your aha moment?
Well, I was always interested in preventive cardiology, mostly focusing on advanced lipid management. mostly with pharmaceutical medications. But after 8 years of practice and just seeing patients continually get sicker despite me, practicing evidence-based medicine, I started delving more into nutrition, and had changed my own diet after some sports injuries that happened. And I wasn't fully plant-based. And then I met Dr. Jacobsohn, who had healed himself with a plant-based diet, and he told me how great he felt, and he encouraged me to go plant-based. So I agreed to do that, and I read The China Study was the first book I read, and that was an aha moment. Literally, I felt like my socks were blown off my feet reading that, and I immediately changed not only my own diet, but the diet of my family as well, including my 2 small children at the time. So that was about 5 years ago. And then it's only natural I completely changed, my practice. And now I would say my outpatient work is probably 75 to 80% preventive, mostly primary prevention. So I do a lot of nutrition and lifestyle medicine counseling, because I'm also board certified in lifestyle medicine. So today I saw 16 patients, and 13 of them were preventive, and several of them we mostly focused on mental health, actually. So
wow, covering kind of the gamut of lifestyle medicine there. And did you notice anything personally in your personal health when you made that change?
Yeah, so I didn't have any major health concerns at the time I made the change, but I was a college athlete and I'm still fairly athletic, and I felt like my fitness went through the roof. I was about 40 years old, 39, when I changed my diet, and I was running faster than I ever could before, and lifting more weights. And for the first time, I was not having a ton of muscle soreness anymore. I was having much easier recoveries, better sleep, better energy. And at the time with little kids, I noticed I wasn't getting viral illnesses anymore. I just wasn't getting sick anymore, even when my kids brought stuff home.
Wow. It's amazing.
Yeah.
Dr. Jacobsohn, same question. How did you find out about plant-based nutrition and lifestyle medicine, and what was your aha moment?
So early 2018, my dad called me. He's a retired urologist, diabetic for 6 years, not doing terribly well on his medication, and he'd hurt his shoulder sledding with the grandkids, and went to see a physical therapist who suggested he pick up Joel Fuhrman's book, The End of Diabetes, to try to get off his diabetic medication. And I laughed at him. I said, maybe you're going to start eating tofu. Little would I know I'd be eating tofu regularly pretty soon. Because all we ate was standard American diet, animal products, 21 meals a week, diet soda, junk. And within 6 weeks, he basically lived with that book. Ate the recipes just from the back, lost 35 pounds, got off his medications. And I quickly realized there was a lot I did not learn in medical school. And really what I didn't learn was how to make patients healthier. That continues to be a huge problem. And it took a minute for me to bring that into my life. But a few months later, we watched Forks Over Knives and said, what are we feeding our kids? What are we raising in our house? And decided to try eating healthy for a week, and haven't looked back. So it sort of evolved over that summer of 2018. And then I decided I felt so good and had lost weight and lowered my cholesterol and got to meet Aimee Welsh. And I decided I better start telling my patients about everything I've learned. Turns out I had no ability to do that very well. And I crashed and burned a whole lot. But we had some really good success stories. So I figured I'd better, as a urologist, go get some actual education. And that's when I found American College of Lifestyle Medicine and, got board certified. And it's been part of my practice ever since.
That's outstanding. Wonderful story. Dr. Dempsey?
I have a longer course of how I, and maybe more gradual about how I came to lifestyle medicine and plant-based nutrition. I've been a vegetarian just myself personally for about 30 years, not fully plant-based, but just eating eggs and dairy, but no meat. And I'd always been interested in health promotion and healthy lifestyles. That's actually why I went into sports medicine about 25 years ago, because at the time there really wasn't a field that I knew of or that I had found that worked on that tried to promote healthy lifestyles. And I thought, well, I can at least do exercise prescriptions, so I'll pursue sports fellowship, and did that for a while, but then realized about 2013 I really wanted to even more focus on healthy lifestyles and not just treat athletes, but really bring this as a tool to prevent disease and treat disease for primary care patients as well, for my primary care patients. So I was previously with the Medical College of Wisconsin. I had left and had decided to start my own small practice, and was literally just Googling names for my practice, for my private practice, and what are the types of what verbs and what nouns and what concepts really capture what I'm trying to do here. And just complete serendipity came across the American College of Lifestyle Medicine and went to that. That was in 2013. I went to my first conference in 2014. And I think that really was my aha moment about lifestyle medicine. Just I've people who I know on this call have heard me say this before, but it was like I found my tribe, and I knew that I was home, and this is what I wanted to do. And this is what I'd been looking for really all my medical training, trying to create this type of practice, but I didn't know that there were already people doing it as well. So joining lifestyle medicine, that's where I went fully plant-based. And also obviously, I had always been incorporating most of the pillars of lifestyle medicine as a sports medicine doctor as well, but really added the other ones with mindfulness and social connection and focusing on my sleep, which is something that doctors are not always really good at. But so I think coming to lifestyle medicine for me was more gradual, but when I arrived, it's just really been feeling like this is what I've been looking for the past 30 years, really.
Oh, that's outstanding. Thank you, Dr. Dempsey. And Dr. Welsh, I know you may have to leave before we get around, but we'll be coming back around.
Yeah, that's correct.
Thank you for being here.
Yeah, so another engagement came up that I have to get to, so I apologize for that.
Dr. Lenz?
Yeah, so I've kind of had a somewhat of a long story. I was always into nutrition, in a sense, curious about it. I was a big athlete in high school, and back before the internet, you'd go to the library and read about things. I was partial vegan because I was too cheap to cook meat in med school, and I'd have a lot of tomato sauce with spaghetti. And my first date I went on with my wife, I didn't even, that's what I cooked. I didn't have chicken. My roommates were grilling chicken, and that's what I was serving her. They gave her some. But anyways, I heard about Dean Ornish in the 90s, and I remember asking a attending about it, and they said, well, yeah, but nobody's going to do that, and you practically need a dietitian to teach you how to do it. And then I was into general internal medicine and pediatrics and training, and you know about the #1 history of heart disease, and you're trying to understand atherosclerosis and why are these people having, in their 30s, 40s, 50s, who are seemingly kind of healthy, still having cardiac events, and trying to understand what type 2 diabetes is. And then I got into lipidology, which was try to prevent heart disease, because I found out I had high risk. I developed lipoprotein A, an inherited condition. I had a moderately elevated C-reactive protein in my advanced lipid testing, so I had a particle number of 2,200. Interestingly, I went on a week or two of a whole food plant-based diet. I didn't tell the doctor, the lipidologist I was seeing, I did that, and I dropped my numbers down to 1,600, but for my condition and family history, I needed to get down to 1,000. I went on a statin, niacin, and I was doing that for about 7 years. And then there were 2 studies that came out in showing that niacin added to a statin had no added benefit, which was deflating, because prior studies showed it had some great hope. And then I read the China study that my wife, Joy, had for continuing education, and that was like 13 years ago. And I said, wow, this makes sense. And I pretty much probably went 97, 98% plant-based, and then went 100% after that, because I said, if I can't do that myself, I can't tell patients. And since then, I've been using that and encouraging people to do that. I got board certified in lifestyle medicine just during the pandemic, and love helping use food as medicine. If you see a car driving around that says Plant RX, I prescribe plants for medicine, food is medicine. So that's my car.
I've seen your car. I didn't know who it was before. Thank you, Dr. Lenz. Dr. Miller.
Yes, Dr. Lenz. I've admired your license plate for some time. You could probably sell it for some major dollars. I guess my way to lifestyle medicine has been in segments across different areas of my life over time. Clinically, working as a clinical health psychologist, I've worked in a number of medical subspecialty areas like gastroenterology, physical medicine and rehab, and oncology, and just noticed a theme across my patients in terms of the things that they needed to do post-treatment to get better and to live well, or factors that they had going on that were contributing to their illnesses. And as I kind of took a step back and saw these different common factors, all these pillars of lifestyle medicine were really really evident. And personally in my life, I had similar risk factors for heart disease, and I was told by my PA that I was going to have a heart attack or a stroke. They just didn't know when and how significant it would be. And I had a grandfather who had suffered a major stroke and a heart attack simultaneously, and was wheelchair bound and unable to speak for the remaining years of his life until he died from another major stroke and heart attack about 5 years later. And I was about 20 years younger than he was at the time of his stroke. He was 65, I was 45. And all I could visualize was, if I don't make a change in something, I could wind up like my grandfather did, and I didn't want that for myself or for my family. And so I started to take a look at what can I do to make a change to get healthier, and started making some changes in my nutrition, looking at what are some major things I know I'm getting that I shouldn't be getting that are contributing to these markers, and saw changes in those over a few months' time. Then probably the major thing that kind of struck me was I was on a PPI for eosinophilic esophagitis. And I read a study about how long-term use of a PPI can contribute to heart issues. And I didn't want that. And so I thought I would wean from my PPI, and I talked to my primary care doctor about that. And he said, you can try it. Not a lot of people are successful. But as I focused on that, I realized that there were things that were contributing to that condition it was all nutritionally based. And so as I made further changes in eliminating meat, it made a huge difference, and I didn't have any symptoms. And I've been able to remain symptom-free for decades now, and have not had any issues in needing to go back on a PPI, which is great.
That's outstanding. This is it's wonderful to see that all of you have found your way here on this path. There's so many people who haven't, and who end up like some of the family members that you've mentioned, that were unfortunate enough to have some major event that before that all happened. And I know Michele talks about that. Some of the PT that she did was in was in a retirement home where a number of people were there, and she was saying these people could have prevented these things, but by good fortune, you've all found the way there. How in your practices now, where you feel it's appropriate, what do you say to patients, or how do you bring this up, and what kind of success have you had in finding people who are willing to embrace this? And Dr. Jacobsohn, I guess I'd start with you here.
Most of the patients I see are patients with urologic cancers. I see there was a question about BPH patients that just came across, so I'll answer that at the same time. The root cause and most of that's prostate cancer. But it's rare that I have a patient come in with just a cancer diagnosis. They come with all the chronic Western illnesses: diabetes, high blood pressure, heart disease, arthritis. The list goes on. And so there's a teachable moment. People come in and they're scared. They don't want to die. Now the C word's been thrown out. And sometimes the C word, the cancer, is the biggest threat to their lives. But many times it's not. And number one cause of death in men with prostate cancer is heart disease. So we have opportunity because for a lot of our patients, it might be the one time in their life that they're going to listen and have an open mind about, what do I need to do to not be here? And so there's an opportunity that we try to take advantage of because ultimately I think most people come to me because they want to live in a quality way. And it just might be that's because they've got a new kidney cancer or prostate cancer diagnosis, or they might not really even know why they're there. So we can counsel them on how to get healthier, how to reduce the number of medications. And it might just be so they can live a better quality of life. It might be so they can get a better cancer outcome or be prepared for the cancer treatments which come in the future. And sometimes it's just planting a seed and they're not ready. And they'll come back in 6 months or 2 years or never. You just don't know. There's an unbelievable amount of low-hanging fruit. People who've just never been told or never heard it before. Or are confused by the media and so have just thrown their hands up in the air and say, I'll do whatever. Doesn't matter. Eggs healthy, eggs not healthy. What do I know? Must be fine, so I'll eat it. And so we can, there's just a tremendous amount of patients who just can be given a small amount of direction, pointed in the right way, and in a 30-minute visit to talk about their prostate cancer, change everything it is that they need to change about their lifestyle and start reducing their medication needs and feel better. And others, it's a lot more. It's a lot more intensive and they need a lot more follow-up. And they have to go slowly. But it's incredible what can happen when people are motivated.
Dr. Miller?
Yeah, for me, it really, as somebody who treats people with both physical and mental health conditions and kind of the combination of that, I take a look at just health in general, and I talk with my patients about what that means. And I start with the foundation of the 6 pillars of lifestyle medicine. It's definitely an area that's underaddressed in mental health. And so looking at how we can change what we're eating, how we're moving our bodies, managing our stress, and the impact that can have on how we feel and what we do in life is kind of an eye-opener for a lot of people. I think they don't really understand how basic that is in terms of like daily living. And when people are doing things that are not healthy in any of those pillars, it can contribute to the problems that they're facing. And so kind of using that as the foundation is what I'll talk with my patients about. But I'm not there to make them be a certain way or to do certain things, but to really see what kind of settles in their mind of areas that they might think about that they could change. and then begin to work with them in those areas so that they can improve. And when it comes to the nutrition side, really leveraging the nutrition knowledge that I gained through the American College of Lifestyle Medicine, and helping them to move away from that standard American diet to a predominantly plant-based diet, and really taking a look at what were the things about the foods that they ate that they enjoyed, and how can they move in those interests but incorporate more of a plant-based approach. So for example, if people are eating bags of chips and they like the crunch, what are things that are also crunchy that they might enjoy? So it might be a texture thing, or it might be a flavor thing. So what can we do to flavor things up in different ways? And when people begin to make some of those small shifts, and then they start to feel better, it just kind of escalates from there. And if they're making a change in one area, it often means that some of the other areas are getting improved as well, like sleep, or they start to feel better for themselves. So they might say, you know what, rather than sit on the couch and watch TV, I'm going to go for a walk. I'm going to go play with my kids or my grandkids, or I'm thinking about maybe joining a league to play some sports with people, or go to the gym, or whatever it might be. So it's really nice to see that that effect that it can have on people. And then I say, you know, if there's things that you're doing that are contributing to your anxiety or depression, these are some of the things that are likely going to be factors. We don't know how big of a factor it could be, but it's worth taking a look at. And so that's kind of where I start, and then overlay my psychotherapies and the different treatments that we have on the mental health side to help people.
Thanks, Dr. Miller. Dr. Dempsey?
Well, for the last 3 years or so, I'm not practicing in the clinical setting anymore, and I've been doing teaching and speaking in the community. But prior to that, for about 7 years, I had the luxury of my practice being really exclusively lifestyle medicine. So I had nice long visits, and I got to focus on, people came to me because they wanted to change their lifestyle. They didn't necessarily come because they wanted a whole food plant-based diet. They didn't know that nutrition, plant-based nutrition was what they wanted to do, but they knew they wanted to address their diabetes or their heart disease or their high blood pressure through strategies in addition to possibly pharmaceutical. They wanted to use lifestyle medicine as well. And I have to interrupt and apologize because I'm at home and my dog is harassing me right next to us. So if you catch a glimpse of her in the screen, that's because she wants attention while we're chatting. But as you asked the question about how do we use lifestyle medicine in our practice, I thought of a story that I want to share about. Really, I was very humbled over the course of the 7 or 8 years that I had my private practice, my lifestyle medicine private practice. The first 3 of the years I was practicing, I was not yet board certified in lifestyle medicine because it didn't exist yet. Certification has only been available since 2017, which is the year I became certified. But prior to that, I was practicing sort of just the best I knew how, having read the China study, having read Dean Ornish, having read Caldwell-Esselstyn, all the giants in our field, and sort of trying to implement what I'd learned from them. And I also had an attitude that in retrospect wasn't a very humble attitude. It was sort of, I'm the expert and here's the information, let me spew it at you. And I think also to some degree had an unrealistic expectation for the patients who came to me, sort of, this is what I want you to do because this is the answer, instead of really trying to meet people where they were. And as Dr. Miller talked about, understanding what are the barriers you're facing, what are the needs that you have, why are you making the choices that you're making, and how can we make those in a more healthy way. So after becoming board certified in lifestyle medicine, one of the criteria for that is that there's a lot of training that comes with that. So I had to do a lot of training in how we address patients more as a coach. And that's one of the really important aspects of lifestyle medicine. We're not just a paternalistic expert, here, do what I'm telling you to do because I said so. We really want to emphasize meeting patients where they are. And so I shifted my approach at that point. Previously, I'd been sort of like, this is whole food plant-based nutrition, and this is what I want you to do, and I want you to be 100%. And now I've come to a place where I realize it's much more helpful for people to think of whole food nutrition on a spectrum. So there, you know, if one side of the spectrum is you're eating 100% plants, that's all you ever eat. The other side is 100% animal food. Wherever someone is on that spectrum, can I help them shift somewhere? So maybe for some people, that's literally adding a vegetable in to one of your meals per day. You're not eating any vegetables right now. Let's try to add vegetables in. And, you know, maybe people who are already doing it really, really well, let's tweak some things. Let's find some great substitutions. Let's figure out what else we can do. And so I think I'm practicing much more humbly now, is sort of to answer your question, how are we implementing this? And I'm doing it in a more humble way. And I think a way that helps people feel less judgment and shame. I think that's one of the worst ways to try to make lifestyle changes is we feel judged, we feel inadequate, we feel ashamed about our current state. So if we can really celebrate successes and see where people are now and build on those, I think that's where I've seen the most success with the patients I'm working with.
Thanks. That's great insight. Thank you. Dr. Lenz?
Yeah, so I get a chance to work with all ages, kids and adults, and preventive and secondary prevention. If somebody's already had heart attack, if already had diabetes, it's really neat when you get a chance to talk to somebody who may have a history of gestational diabetes that's normal now to say, hey, you're at risk, family history. Like Rania, I have had some humbling because I assumed after kind of imbibing this that all these plant-based experts in their clinics had a 90% compliance rate, and they were all doing this, and everybody was reversing heart disease, and realizing that even if you can give the information to quit smoking, not everybody does it. And always have an interest in mental health, and a lot of my practice overlaps with a lot of mental health that I do, and that overlaps with kind of evolved into also interest in chronic overlapping pain conditions, but kind of a success story. And you can hear the whole story. It's might make you cry a little bit, but it's from a podcast episode that I did, and it's entitled a little bit of clickbait, but I want to wear a bikini and run a 5K. And it's about a woman who came in in severe chronic pain, severe mental health comorbidities. And through the combination of doing some medical management, but also incorporating encouragement, she has now lost like 70 plus pounds, basically reversed her chronic fibromyalgia and related issues. Blood pressure's improved, and she's very close to, in this summer, she's walking 10,000 steps and plans to run her first 5K this summer. And so it's a really positive story when you can help. And my wife is a dietitian. I've kind of sort of transitioned like, hey, my patients who do this, it works. I know it may be hard. And then I had a little humor. I said, well, the average patient really struggles with this and often, may not be doing this. The good news is I don't have average patients. I have exceptionally good patients. So don't ruin my record. No, I'm just kidding with them. But I say the ones that do this are going to be doing better, and hopefully by encouraging and to whatever degree, and then recognizing things like, hey, if your spouse does this with you, you've a 5 times greater success rate. There was a presentation at a conference of a cardiologist out in Sacramento who had implemented a plant-based program and a team approach and found a curious finding. So it's like, hey, getting that family involved. I have patients that see me because they want a plant-based doctor, and that's fun to help encourage them. And sometimes you hear stories where my spouse is not interested in eating plant-based. In fact, she kind of makes fun of me, and so do the rest of my extended friends. So it's kind of like a support group. But no, I love using food as medicine. If I didn't have lifestyle medicine, I think it would be not as much fun to be a doctor, not something, it would be something that isn't much to look forward to. And I think this is a kind of an antidote to burnout in medicine.
Well put. Thanks for that. Let me ask you a quick question for each of the 4 of you. For the patients that you have that embrace lifestyle medicine and kind of go all the way all at once, do the benefits come more quickly? And in a follow-up is what out of the patients that embrace and do lifestyle medicine and plant-based nutrition correctly, what percentage have positive results and what percentage have negative results? And Dr. Jacobsohn, I guess I'd ask you those first.
Well, when I talk to patients, I write a prescription for change.
Mm-hmm.
And that usually, it's a conversation with the patients about what the prescription should be. So that's sort of the meeting the patients where they are, to use the way Dr. Dempsey described it, though. I think I ask for a lot. I ask for a lot, not because I lack humility, but because I know that I won't ever get everything I ask for. So if I don't ask for a lot, if I ask for half, I'll get a quarter. But usually that prescription is to either make a pretty rapid change all in for 1 month. Typically that's around nutrition, but it might be around exercise or meditation or all of the above. Or we're going to go slowly, and that's to take the Band-Aid off slowly. So can we change breakfast for a week? Can we follow that up with some lunches for a week? The challenge with the slower approach, and it's not to say it's wrong, but the challenge with the slower approach is it won't feel good. You won't feel the changes quickly. If all you do is change breakfast and 2/3 of your meals and snacks are still terrible, you're going to continue to feel badly. And feeling good is the ultimate motivator. I have more energy, my erections are better, my sex life is better, I'm in a better mood. This keeps people going. I ate avocado toast for breakfast and I don't feel any different. I get to the end of the week and I'm like, why should I stick with this? I feel no different. So you have to share that with patients so that they stay motivated. But the changes come very quickly, especially if people are far from ideal in their lifestyle to begin with. They will feel it because it's like, we're going to the dark side of the moon here. There's no question I'm no longer where I used to be. Most of that is good. Most of that is increased energy, increased well-being, clarity of mind. Sometimes that's the effects of I never ate lentils before, and my gut doesn't feel good. Rapidly changing your gut microbiome and eating raw foods and lots of fiber is a rough process for some people. And so that part isn't necessarily the world's greatest feeling. But that's all part of the counseling, right? These are the things to expect, right? This is how we're going to try to manage that. Try some cooked vegetables. If you're not exercising, you don't go straight for 2 hours of weightlifting at the gym and expect to be able to get out of bed the next day, right? We're going to start with a 10-minute walk. We can only do a 5-minute walk. We're going to do a 5-minute walk, right? We got to work our way up. We got to work our way up to full speed. But the beauty of that prescription, and this is one of the things that I learned from my lifestyle medicine training, is it's time limited, right? So almost everybody can say I can do anything for a month. But a month is enough time to feel a huge difference. A month is enough time to still remember what it felt like when you weren't healthy. But to notice my weight is down, my blood pressure medication needs are down, my fasting blood sugars are so low I don't even need 3 digits anymore. And that's rewarding for me. And patients are happy, and their spouses are happy. I can't tell you how many people, to go back on what Michele STAMM said earlier. I see a lot of men with prostate cancer. We're fixing their diabetes, and they come in for a follow-up visit, and the spouse is raising their hand to say, my arthritis is better. This is great for me too. And that's what keeps people going. I don't really remember if that's what you asked me, Terry, but I just started talking. So if there was something else you needed to know, let me know.
Well, yeah, that was great. That was great. And the other three of you too, if you can, when you answer this question, put in success stories too, would be great. And this will be the last question, I guess, before going to Q&A in general. So, Dr. Miller, I guess that kind of that same question.
Sure, I think Dr. Jacobsohn articulated it extremely well. You know, it's that partnership with your patients to figure out where they're at and sharing that vision or that prescription with them to say, you know, this is a way to help you manage your condition and to feel better and to live a better life. And they really need to value that to be able to then start and make those changes. And when they do, and we can get people to recognize that whatever it is that they value on their health, and we align this approach with that, I think we can see a lot of great change. Absent that, I think it can be a rough road for a lot of people to get them to make that change if they're not ready, they're not willing to kind of embrace what it's going to take to get through it. I think part of the things that I found successful in the work that I have with patients is by sharing my experiences or experiences of other people that I know to kind of help people to recognize, you know, these are some of the things that might occur, and it's not easy, and there's what can be done to get through it. And I think people feel less alone or less like on the spotlight with things. They just see it as this is just kind of how we need to get to where we're at, to where we want to be. I've seen some major shifts in probably the biggest success I had with a patient was somebody who was consuming a high amount of sweetened beverages and had a lot of anxiety, and were able to make some shifts away from those sweetened beverages and manage the anxiety very, very well. Almost made me wonder, was this a person that had caffeine intoxication versus coming in for anxiety? I knew it was more generalized anxiety in the way in which they described their anxiety, but she really embraced that, understood the need for that, had been thinking about it for a while, and we just aligned at the right moment in time for her to say, I'm going to make this change. And she did, and she went in she went all in, and she went from whatever 12 pack she had of soda, and she made that shift after that, and she substituted with the plan that we had, and she did great.
Oh, excellent.
So, not plant-based, but part of what we're putting into our bodies. And I think we can't overlook some of the beverages that we consume as well and the impacts that can have on things. I saw some things in the chat about somebody who still might have like high A1C levels and other things, even going plant-based. And part of me was, as a non-physician, just wondering like, hey, I wonder what might be happening for that person in terms of the things that they're drinking, and if those can be contributing factors.
Thanks.
I'll leave it for my medical colleagues to chime in on that, but that's things that I've seen.
Thanks, Dr. Dr. Dempsey.
I think, Terry, you asked two parts to your question, I think, and remind me if I'm not getting this right, but I think the second part I might want to answer first, which was in people who do this, you know, does it work? And there's the vast majority of chronic disease is attributable to lifestyle. So it always works to some degree. There are certain genetic conditions which are much less common where, you know, maybe you can't get that cholesterol as low as you want it to be, but for the most part. And I think we also have to use the frame of works, not just on looking at specific numbers, but how does the person feel? What's their energy level? How are they sleeping? How are they pooping? All these things that we know are better with the plant-based nutrition lifestyle and lifestyle medicine in general. So yeah, for people who really do it, I see great results. And also you asked about some of our success stories, I think, what people who really do want to jump in and you know, people who embrace it and are willing to go all in versus a more gradual approach. And some of lots and lots of favorite stories, but I'll try to limit to just one or two. But one of my favorite ones, in addition to having my private practice, I also was a volunteer physician, and I practiced lifestyle medicine and led a lifestyle medicine group at the Lake Area Free Clinic, which is a clinic in Oconomowoc for uninsured people who are living below the 200% or less than the federal poverty level. And so this is obviously a population that, you know, isn't shopping at Whole Foods and doesn't have an expensive gym membership that they can go work out with a trainer each month. This is a population with, you know, limited access to healthy foods and limited access to places to exercise and high stress levels, often working 2 jobs or working, you know, night shifts and things that make it very difficult to engage in healthy lifestyle choices. And so that's probably why this is one of my favorite cases, because it was so inspiring. I had a patient who was a man in his probably late 40s, who came in with a new diagnosis of diabetes. And he had parents and siblings who'd had severe complications. His father had had a foot amputated, eyesight loss, kidney problems. And he absolutely did not want to go down that path of having the complications from diabetes that he'd seen his family members have. And at the time he was diagnosed with diabetes, we also found that his blood pressure was high, his cholesterol was high, and he was really scared. And I think Dr. Jacobsohn mentioned, you know, sometimes fear can be a really big motivator. And in this case, it really was for him. He said, you know, tell me what to do, I'll do anything. I just don't want to lose a foot. I don't want to lose my eyesight. And so he was willing to, and I said, sort of took a similar approach. Well, I'm going to give you something that's a pretty intensive lifestyle change, but can you do it for a month? And can we see what happens? And he focused on 2 pillars of lifestyle medicine. Actually, really, it was more than the 2 we talked about were nutrition and exercise. But he also, he was in a support group, so that offered a lot of positive social connection. We had a diabetes support group in the free clinic. And we did talk about sort of the other pillars as well as in how they supported his lifestyle changes in nutrition and exercise, but he primarily focused on those. And he was willing to go completely plant-based. He was, you know, we found him, actually got him a scholarship membership at the Y. He was able to participate in exercise classes at our local YMCA. And in 4 weeks, his numbers had improved drastically. The hemoglobin A1C takes a little bit longer. That was only slightly, I don't even think we checked it at 4 weeks, but his cholesterol, even in that short time, his blood pressure had normalized. He was off his medications that he'd initially had to be on. And that was, the reason that's one of my favorite cases is just that he was so able, you know, if anyone faces challenges, he did, and yet he was able to make these changes and really embrace lifestyle. So it was, you know, really inspiring. So.
Oh, it's a tremendous story. Dr. Lenz?
Yeah, just to echo what everybody's said, I have this balance, and I will say, you know, this is extremely powerful. So powerful that I want you to be checking your blood pressure every day, because you're on 4 blood pressure medicines. Your blood pressure is going to drop if you do this. And it might drop so much you're going to have symptoms from low blood pressure. Your blood sugars are going to drop significantly. You're already on several diabetes medicines, including insulin. You need to be watching your blood sugar. And now with continuous glucose monitors that we're using, we're going to have to make regular, quick adjustments. I don't know how quickly. It might be 24 hours. It might be 40 days. We don't know where that cliff of change. And of course, if you're 40 versus 80, when you make changes, you may have stiffer arteries, and how long it takes to improve that blood pressure and how much insulin resistance you've been area under the curve, so to speak. But this is extremely powerful. And then just echoing that, you know, this is caused by the food you eat. This is the choices that you make. We can give you a GLP-1 agonist, and I have a blog post about this. I say, you know, our cure to obesity is not to spend, you know, $13,000 on everybody in the country. You know, the 30–40% of people are obese by spending, you know, $13,000 a year on GLP-1 agonists. And most people here probably know this, but the action of that is through how fiber acts in the large intestine, telling bacteria to release free fatty acids that turn on these GLP-1 receptors, and that's how it works. I said, why don't you eat the food naturally? And when you talk about immigration studies of people who come from other countries where they're plant predominant or and then live in the US and their blood pressure rates go up. So again, that experiment, let's try this. I agree when you want to meet people where they're at and you can kind of get this hint. And then if they're resistant, I'll say, well, you know what, you want to lose weight. People ask, well, what's the best book to read? If there's a younger population where the chronic disease hasn't manifested completely else and they're focused on trying to lose weight a little more, I'll say, well, let's talk about how not to diet. Read the book by Dr. Greger, and you're going to get a in-depth understanding why you've been yo-yoing on your diet for your whole life. Get a chance to review that and come back. And if they're interested, that helps lay the seed and other resources. It's great if you have working with a dietitian to help coach on what to eat. I know I have a couple patients that are listening, and one of them said to me, I want to, but I am so tired. When I get to the end of the day, it's a long day. The last thing I want to do is cook. And I said, well, go talk to Amber Lynn, get her on her list. And then you can get at least a few extra meals a week that you don't have to worry about that and be more consistent. So it's that fine line of encouraging, but saying, this is super powerful. If you do this, your numbers can potentially quickly drop. I think that it's something they've never heard before. And that's often something where people may be like, Dr. Lenz, I've been going to doctors for years. Nobody ever told me this. I honestly remember probably 20 years ago thinking, maybe 20 plus years, when people go, well, doc, a new diagnosis of hypertension at age 35, 40, and I go, well, so many % of people age 40 have hypertension. And well, how long do I have to be on these medicines? And I'm like, well, your whole life, like, unless you make major diet changes, you'll never get off these. And they're like, what? Now I say, well, I used to tell people that. And now I say, well, no, you'll get off your meds, especially if you're that 42-year-old that's getting started on lisinopril that's been creeping up from the stage 1 to stage 2 hypertension, where it requires meds. And then you drop them from 145 to 132 on lisinopril. And then I'll go, well, yeah, but we just change your diet. You won't even need this at all. And we'll reverse your fatty liver and you won't have to have this. And it's not inevitable. And then I do encourage, if you're so much in the video age, people say what book to read. If I got a younger person, I'll say, especially a male, I say, watch The Game Changers. If you're more into the chronic disease, watching the classic, ones like Forks Over Knives and What the Health kind of things. And then the other books to read. If you had heart disease, read Prevent and Reverse Heart Disease, diabetes, arthritis, the different autoimmune type books out there.
Yeah, that's great. A lot of good resources. Well, I think we've only got about 10 minutes left, or less than that. Yeah. So maybe we can look at the questions, see if there are any questions here. And if
the lady she's just walking around the whole time.
I didn't hear that.
Why is she showing herself?
Oops. Let's see. We've got. I'm just looking through the chat box here. Yeah, and one of the questions from Deb was, what are the best books to start with? And I would personally mention the plant-based, the Forks Over Knives program. And that's a very good book by a husband and wife who are doctors, and they explain it very well. But if anybody else wants to shoot a book out there.
I think they mentioned just Dr. Greger's quick website that has very specific. So if I have somebody with gout, he has some very good medical evidence. somebody's got a kidney stone, I sometimes even watch the 5-minute video with them, and he talks about reversing kidney stones and the gout so sometimes you can get that real-time education.
Let's see, just looking here, my husband's been, I think this was the A1C here. Carol mentioned my husband's been eating plant-based for 2 years. He's lost weight happily, but still struggling to lower his blood pressure and A1C. In terms of eating plant-based, what foods are most helpful to lower blood pressure and A1C? His doctor wants to increase his blood pressure meds and wants him to take metformin. He doesn't want to take any more meds. Would anybody like to?
You know, with diabetes, it's kind of a tricky one because you can develop some adult onset type diabetes where you start to, or not adult, some hybrid where you have some decrease in insulin production. So there may be an aspect of that. So you have to be careful in an individual case. These are especially in people who are relatively lean. If you have a fair amount of abdominal adiposity still, that means there's still room for improvement. And then kind of really focusing on the lower glycemic foods with the high nutritional density. So beans, berries, barley, and trying to, use water, try not to drink your calories. Those are some of that issues that may be going on. Sometimes I've had patients where they'll eat foods that are sweeter. When I say sweeter, there might be more dessert types, might be more flour based. So some people it's trying to have to be a little more stricter, having more intact grain and not processed foods, or even though it's plant based. So to what degree,
Yeah, I think this is a good point, and that is, the focus is on whole foods. It's a whole foods plant-based diet, but we don't want to go to the store and find the things that are labeled plant-based. We want to find the things that don't need a label. And the trick for diabetics, of course, is the low glycemic index foods. And I usually send people to that same book my dad had, which is Joel Fuhrman's book, though it's not the only one. Masteringdiabetes.org, or the Mastering Diabetes book. A couple just tremendously motivating type 1 diabetics who've mastered how much insulin per carbohydrate, and they've got a coaching service there that people can pay for, but lots of free stuff too. And if you fix your diabetes, you're gonna fix your blood pressure. I mean, it's just as good as it can get, right? You might not find yourself at 100 over 60 off meds, but you're going to get as good as you can get. But it sometimes takes being extraordinarily critical about what you're actually eating, and looking to see what am I truly doing? Am I doing what I think I need, what I actually need to be doing? That might mean involving a coach for a short period of time. Might mean bringing a food log to your doctor to say, this is what I ate, and I'm not getting the results I think I should. And sometimes one of us can look at that and say, how much olive oil did you put on that? All that fat's driving up your glucose. So involving a professional can really be helpful if you're struggling, but a lot of times it comes down to not eating whole foods.
There's a question in the chat came up about finding a doctor who works with diabetes in the area. We do lifestyle. We do virtual visits. Actually, tomorrow morning I'm doing half a day of just virtual visits. So if you're in Wisconsin, I can see you and love to help people who want to learn more about this. And then how do you know if it's the meds that are causing the improvement so you can get off the medications? You have kind of an idea of what % reduction, like a blood pressure drops the systolic 10 to 20 points. And that's where it gives me an idea where if somebody is uncontrolled, we add lifestyle to their medications and then they drop, and I'll say, okay, now when you get in the 110 to 120 range, then we likely will stop one of your meds, and then we'll track that because it might bump up, 15 points, and use that as a tool. We have ideas what the % drop you're going to get with metformin or a GLP-1 agonist or these other medicines. So you have kind of an idea. If what to expect from the medicine and how much is it your diet. And that's something that has to be watched very carefully, especially when you're withdrawing medications. And that's something where I have to say, send me every few days where your blood pressure readings are, especially if they're really going to go from a standard American diet to whole food plant-based diet. That those are fun things to peel back medications.
And I think you saw that, Dr. Lenz, you are taking new patients.
Yeah, I'm taking patients. You could probably even, I think I have one opening tomorrow morning if somebody wants to make sure it's, or in that. So yeah, and that's one where if you're in the area, even if you're in Wisconsin, I can do that. Eventually we'd like to see at least periodically somewhat in person to do an exam.
Yeah, that's great. It's often takes a long time to get in. I would like to ask each one of you one more question, but we're running out of time here. So I'm just gonna jump here. Our next quick reminder, our next monthly meeting will be Thursday, March 14th at 6 o'clock Central Time, where we'll be hearing from Dr. Sandra Musial. If you'd like to receive notice of this or other upcoming PBNOW events that are not currently on our list, excuse me, just Google us at pbnow.org or PBNOW. Once you're on our homepage, you can subscribe to receive email notice of our upcoming events. Also, remember, if you'd like to check out our past meetings, just go to the video library section or on our website, or search for us on YouTube under PBNOW. And you can go back and watch entire talks or skim through to the parts of each presentation that may be of particular interest to you. Thanks again so much to our speakers, Dr. Liberman, Michele STAMM, Dr. Jacobsohn, Dr. Dempsey, Dr. Lenz, Dr. Miller, and Dr. Welsh for sharing your valuable time and knowledge with us tonight. Thanks for coming, everybody.